Okay, well, it's a real pleasure to participate in this video conference. We all are being affected by COVID. I think it's important that we share our experiences and learn from each other in addition to the literature, because we are all in this together and all have things to learn that are new on a daily basis. As someone said, we are flying the plane while we are building it.
Құрметті әріптестер, ханымдар мен мырзалар, жаңадан ашылған Galamdyq-sheshim COVID-19 ақпараттық арнасындағы бүгінгі алғашқы іс-шарада бізге қосылғаны үшін алғыс айтамыз. Мен сіздің жүргізуші Динара Демеубаева, дәрігер зерттеуші бағдарламасы бойынша бірінші курс магистранты. Бүгін бізді белгілі баяндамашы Ларри Ленс, МакГилл университетінің балалар пульмонологиясының профессоры, Монреаль, Канададан қонақ болып келіп отыр. Біз сондай-ақ Нұрлан Дәулетбаевтың біздің байланыстырушы буынға айналғанына қуаныштымыз. Профессор Дәулетбаев Марбург қаласындағы Филипп университетінің трансляциялық зерттеулер зертханасының директоры, МакГилл университетінің және Қазақ ұлттық университетінің профессоры. Көрермендерге айтарым, біздің бейнеконференциямыз YouTube арнасында тікелей көрсетіледі, ал ағылшын тіліне аударманы екінші жүргізуші Әл-Фараби атындағы қоғамдық денсаулық сақтау бағдарламасының бірінші курс докторанты Айгерім Алияқпарова жасайды. Уважаемые коллеги, дамы и господа, благодарим вас за то, что присоединились к нам на сегодняшнем первом мероприятии в нашем недавно открытом информационном канале «Глобальное решение COVID-19». Я ведущая Динара Демеубаева, магистрант первого курса по программе «Врач-исследователь». Сегодня нам повезло иметь известного докладчика Ларри Ленса, профессора детской пульмонологии в университете МакГилла, Монреаль, Канада. Нам также повезло, что Нурлан Дәулетбаев стал нашим связующим звеном. Профессор Дәулетбаев является директором лаборатории трансляционных исследований в университете Филипп в Марбурге, приглашенным профессором в университете МакГилла и в Казахском национальном медицинском университете Аль-Фараби. Обращаясь к аудитории, я хотела бы напомнить, что наша видеоконференция транслируется в прямом эфире на канале YouTube, а перевод с английского будет сделан нашей второй ведущей, докторантом первого курса программы общественного здравоохранения Казну Аль-Фараби Айгерім Алияқпаровой. Ал келесі сөзді құрметті профессорге Нурлан Дәулетбаевке беремін. Я передаю речь нашему уважаемому профессору Нурлану Дәулетбаеву.
Thank you. Professor Lance, thank you very much for agreeing to contribute to our very first live information session.
It's a pleasure to be here.
We plan to transform this information channel into a vehicle for knowledge translation between McGill University and Kazakhstan.
I think this is a perfect opportunity and a wonderful platform to be able to share our knowledge and our experiences.
Your participation in this session is very much appreciated, and I will let our hostess, Dinara Demeubayeva, tell the audience about the program.
Бірінші бөліміміз ең соңғы әдебиеттерді талқылауға арналады. Көрермендерімізді YouTube арнасында түсініктеме түрінде сұрақтар қоюға шақырамыз. Біздің әріптестеріміз осы сұрақтарды жинап, топтастырады. Наша первая часть будет посвящена обсуждению самой последней литературы. Мы призываем аудиторию размещать вопросы на канале YouTube в виде видеоконференции или комментарии. Наши коллеги соберут и сгруппируют эти вопросы. Келесі кезең презентацияны ұсынамыз. Представление презентации.
Professor Lance, just to make sure that our translation can keep up, we will ask you, and I will also try to speak very slowly.
Yes, I hear you. I understand.
So for now, I will switch to presentation, and I prepared those slides. Some of these slides I will present myself as an introduction to your main presentation, and then you will take over.
Okay.
Okay, so that's, I'll put my presentation on the full screen. And please don't be surprised that you see two slides in different languages. This is for the sake of our audience.
Mm-hmm.
it will be like this. As you see, we'll have a brief discussion of published knowledge. You will discuss epidemiology, clinical manifestations, and then we'll discuss what children should we consider as vulnerable population, as well as return to daycare and school. Yesterday, you and I had a very good discussion about safety recommendations, both for children and for medical personnel. So if you can maybe elaborate on safety recommendations, that would be very much appreciated. And if you can share your recommendations on clinical safety and infection control. And if we will have questions, we'll have a live question and answer period. Is this working for you?
That'll be fine.
So I'm just showing the slide again with our agenda so that the audience will have time to catch up. And so I'm moving on to the next slide. We will try as much as possible to abstain from professional terminology because our audience is mixed. We will have students as well as professionals, and some of general public is watching our presentation live. That's why I put together this slide with various terminology that you will probably mention, such as PFT, such as PPE, and here is the translation of this terminology. And this is just a brief introduction, why we need to keep an eye on literature. Ideally, when we deal with literature, medical literature, we want to have evidence about our diagnostics and treatment as strong as possible, while the bias or systemic error should be kept as low as possible. And if we have an experience from any single country, be it Kazakhstan or even China, we still risk having very high bias, while our evidence base may be very low. So here is again in a different language, so our bias will be very high and our evidence base will be very low. In case of countries like Canada, because Canada has been a birthplace for the concept of evidence-based medicine, I would probably think that this bias is lower and the evidence base is higher, but still it makes sense to consider all evidence that is available to date. And this is great that we have you, because I will show the role of an expert in critical appraisal of the literature. Because we want to have a systematic review, we want to have hard evidence, we want to be comprehensive, and we want to have as low bias as possible. And here's the slide again in a different language. And the problem with the current pandemic is the following. There is an avalanche of data. I believe that every day, something like 2,000 papers are being published, all dedicated to COVID-19. This is the map, world map that we made on the April 10th. Right now, we have almost doubling the numbers. So another problem that we have is, apart from excessive volume of published data, is that many publications, they are very timely, but have different limitations. And yet another problem is how to find out the publications on pediatric population. And here is the slide again in a different language. And concerning the pediatric population, I made the slide as a comparison. We have a great body of evidence from adult patients. It looks like the planet Jupiter, whereas in comparison, the pediatric data is very small. It's like Earth in comparison to the planet Jupiter. So what can we do in a situation like this? So we can ask an expert, such as yourself. And I would like to introduce you to our audience. You're not just a pediatric respirologist, and an expert in genetic and rare diseases of the lung. You also direct Division of Pediatric Respiratory Medicine in Montreal Children's Hospital. You're also director of the Cystic Fibrosis Clinic. You're director of a Neuromuscular Clinic, and you're an attending physician of Transplant Clinic. On the research side, you're a chair of Canadian Thoracic Society Research Committee, and you're a full professor at McGill University. We are very happy to have you with our presentation, and I would like to now pass the microphone to you, and I will just continue showing the slides, but if you would like to start discussing the published data, that would be the perfect time.